Welcome back to The Line. The New Mexico Human Services Department is taking steps to reverse course on plans to charge some Medicaid recipients a monthly insurance premium of $10 and a copayment of $8 on non-emergency use of hospital emergency rooms and non-preferred prescription drugs. Governor Michelle Lujan Grisham announced her decision this week to reverse several policy decisions made by former Governor Susana Martinez. Without a reversal, the copayment policy is set to go into effect March 1st. The premium policy on July 1st. All told, these policies would affect over 700,000 Medicaid patients. Stephanie, Susana Martinez had designed the plan to conserve state spending on Medicaid and transfer, modest costs to the patients, but the new administration says removing these barriers to care will actually improve the health of the Medicaid population. It seems interesting on paper. I'm not quite sure how that teases out in the long haul. What's your top line take on that?
We have a little bit of time to address the solutions into as far as like what exactly was the Martinez administration intending to do for cost savings.
Right.
I think what the near term real focus is, much in the same way that we were talking about education and our public ed needs, is what are the needs of our population that need access to health care the most, and that is access.
Right.
And doing this from a policy standpoint and just from a direct service standpoint will increase access. And bottom line, I think this is a great policy move. I think across the board, she is really smart to do this, and I think that it's going to help a lot of New Mexicans like immediately. And when you're looking at somebody who is again like trying to decide whether or not I'm going to be able to pay for my electric bill or my groceries or go to the emergency room, I think
we have to be sensitive to that. $10
right.
here, $10
it's
there.
relative.
It means a lot in a lot of families.
Absolutely.
Exactly right. Do you agree with that, Daniel Foley?
This is bizarro world conversation again. I mean, $10 means a lot. Look, $1 means a lot. 50 cents means a lot. I mean, at the end of the day, we've expanded the roles of Medicaid at an unbelievable pace. I mean, the amount of people that qualify for Medicaid in New Mexico compared to the median income is totally out of proportion. And to turn around and say we're going to charge $10 and $8 when people out there are going to work every single day and paying $500, $600, $1,000, $1,200 for care, for us to say that for someone to find $10 or $8 to go get drugs that are not on the prescription, that are really not approved to be on the prescription thing, or to go to the emergency room. And the reason that they are implementing this, which is the same reason that insurance plans across the country are increasing copays to go to emergency rooms, is because emergency rooms cannot become doctor visits. Right. And so you're trying to encourage behavior, or go to urgent care, make a doctor's appointment. I think this is a huge problem. I mean, but listen,
is it trying to control that behavior through the pocketbook? Is that appropriate?
That's how you control behavior. Okay. You have no other choice. You can ask people.
Right.
We can tell people we've put out urgent cares. So what you do is by putting in copays, you're directing the actual behavior of the people that are utilizing the copays. And so, I mean, to ask for $10 and $8, for us to make it sound like now all of a sudden we're going to have 700,000 people that can't get health care is absolutely absurd.
Let me read you a quote, Giovanna, from the governor. She says, "I have no intention of implementing policies that put a financial strain on low-income New Mexicans, as well as administrative hardship on our health care provider network." One could read that as a dig to the previous administration, perhaps, but does that make sense to you, that what she's trying to get across here?
Yeah, I mean, I think there are more issues, right? So it's not as black and white as like co-payments drive behavior, because we know that they don't as well. Like I disagree with you that they don't, and the new secretary has stated that too, with some backup with research. But there's also the issue of when you start charging these co-payments, you see people not taking care of themselves the way they would if they didn't have to pay those co-payments that they're used to, especially when $10 really is their grocery bill. And so I think what the governor is also getting at, and the administration, is that there's going to be actual access to health care and issues in the care as well. It's not just the copay, but it's actually the services, and that's going to be impacted as well.
Interesting you mentioned that, Giovanna, because Tom, picking up on Giovanna's point, the press release also mentioned that the decision to pass costs to patients didn't consider the shortage of providers, especially in rural areas, didn't take into account how many med patients already use those services. Do you know what I mean? You just can't make a clean like this and not consider all those other factors. Is that an appropriate or fair response?
I think that New Mexico's in a unique position.
Right.
Okay, we have 48% of our population qualifies for some kind of federal assistance.
Right.
So that means already the rules are different, and we have to take a look at it from that perspective. How do we help the most vulnerable?
Yep.
Governor Martinez started the ball rolling. She started that relay race by expanding coverage to Medicaid recipients. And so that was huge. That was a fantastic move, one of the highlights of her administration. And then Governor Michelle Lujan Grisham comes in, and she takes that baton, and she says, you know what, we're going to take that one step further. We're going to take out that additional barrier to allow more New Mexico residents to access the system, so that way we don't create that funnel that people say, you know what, I'm just going to go ahead and wait until it's really bad and then go to the emergency room. So I think that this new approach that David Scrace went ahead and Secretary Scrace discussed, I think it's a smart approach. Is it going to please everyone? No, but it helps folks where the $10 or whatever that copay is, helps them one more reason to go get that regular care.
Sure. Stephanie, another interesting point here of the Martinez administration policy change, that retroactive eligibility has already been phased in January 1. And this creates sort of an odd, squishy thing from 3 months to only 1 month and eliminated completely by 2020. So go ahead.
Well, I think the bottom line here is that they want to prevent any lapse in coverage.
Right.
And so I think this policy fix does that. And I think it's a creative solution. And I think we need to, not just in the realm of Medicaid, but across the board on all policy issues, that are really pressing in our state. These next, 100 days that the governor's in office is looking at what are the opportunities that she has to do these exact type of things, and I think the coverage piece and the eligibility piece is really, it's really important. It's an important part of the equation to increase accessibility, for sure.
Good point there. Dan, I got one for you. Got about a minute and a half here. A little off a little bit, the proposed legislation that's been interesting that would expand state Medicaid program to create a pay-in, buy-in program for residents that fall in that little squishy area where they make a little too much to qualify for Medicaid coverage. You know what I mean? It's a interesting idea. Do you see, I heard your first point here at the table about we're just lording on Medicaid stuff. It just feel like just another one for you? We're just expanding more?
Here, we don't have enough time to have the conversation, but Gene, this is a self-fulfilling prophecy. Medicaid doesn't pay enough for doctors.
Right.
So when you keep expanding the population that's going to see Medicaid, then the amount of people that are paying for insurance, their cost goes up. Therefore, more of them qualify for Medicaid, which means doctors don't want to come here. There's a reason why we have a shortage of physicians and a shortage of individuals coming here to work. It's not because there's not a lack of sick people. It's not because it's not a beautiful state. It's because you literally come here to work and you can make sometimes less than half of what doctors in surrounding states can make to do the same thing. Because 90% or whatever the percentage is of the population that you're seeing is Medicaid folks. So at the end of the day, with all due respect, copays do drive behavior. That's why companies do them. That's why it's done in healthcare plans. That's why this was being implemented. I just think it's a very short-sighted opportunity. But again, we got $3 billion. We got $3 billion extra dollars to spend. We're going to put oil and gas people out, charge more money here and there, and we're going to be back here a year from now going, where do we make this
Let's see how it
up?
plays out. It could be interesting. That's all the time we have for this week. We're always planning the next show, though, and we have a Facebook group set up to let you give us some ideas about what to cover. It's called Focus on New Mexico. You can also drop us a note on YouTube or slide into our direct messages on Twitter.